Good afternoon, and thank you for joining us today as we talk about the COVID-19 pandemic here in Erie County. Today we have 24 new cases of COVID-19 to report, and sadly, we have 3 additional deaths that have occurred from Erie County residents, according to the NEDS reporting system. Since last Wednesday's press conference, we've had 231 additional cases and those 5 new deaths. I have to admit that this is a bit alarming to me at this point of the pandemic. Now that the vaccine is available to all adults, our case numbers shouldn't be staying as high as a highly steady number as they are, and the community spread should not be as prolific as it is. And we shouldn't still be seeing a significant death count. A report coming in this morning said that 46.4% of the eligible population in Erie County has not been vaccinated yet. So please, I ask you to make an effort to get your vaccine if you have not yet. Get it as soon as possible. Encourage those in your circle of friends and family to get it. Because being fully vaccinated means that you can safely participate in more activities. And being fully vaccinated also means that you can participate in more activities without wearing a mask. The Erie County Department of Health reminds residents that the COVID-19 virus can still infect people, most particularly those who are unvaccinated. We can bring down the number of positive cases if we all work together using those proven methods of disease prevention that we've talked about here for well over a year, including hand washing, including wearing your mask for those who are unvaccinated, and of course, in the last number of months, vaccination. And if you're feeling symptomatic, we ask that you get tested right away. In fact, for your convenience, we have 2 opportunities to visit our mobile testing unit this week still. Tomorrow, you could go to the Enborough Elementary School from 4 to 6 p.m., or on Saturday, you can go to the Harbor Creek Junior High School from 10 a.m. to 2 p.m. And now I am pleased to welcome back our hospital partners with me here today to share updates from each one of their facilities. And we'll start today with John Gennaro, the director of Erie's VA Medical Center. John?
Thank you, County Executive. I'd like to recognize the work that your office has done and our partnership with the Erie County Department of Health and our community hospitals throughout this pandemic, so thank you. Today, the Erie VA has administered over 70,000 vaccinations. We are currently now offering walk-in clinics to all veterans, their spouses, and caregivers at our main Erie campus, and those occur every Tuesday and Thursday from 8 o'clock to 4 p.m. And to save you time,
Okay, I'll go to something else for a minute. All right, I think we're having a little bit of a Zoom difficulty right now, so they're going to reset the Zoom. So I'm going to do some of my end talking points here at this moment, and we will come back to the media for questions very shortly. So in the meantime, I'm going to announce our star business for this week, and that's Andromeda Studios on Westlake Road. They're doing a great job. Their staff and customers are masked as required, and they are operating by appointment only or call-ahead scheduling. They're limiting the amount of people and guests in the facility, and the artists are kind, courteous, and professional. They are screening customers upon entry and have a very clean and sanitary environment. As always, there's so many great businesses out there that we want to thank for doing their part. And right now, it's particularly hard for our businesses with some of the mask wearing new rules, new allowances. So I ask everyone to please respect the businesses and what they decide to do. We all know that if you are not vaccinated, you are still required both by the CDC and the state to be wearing a mask when you're out and about with other people outside of your home. And so we ask that everyone respect when a business has on their front that masks are required for everyone, even vaccinated or non-vaccinated, because it's become very difficult for businesses to decide how they navigate through this new CDC and Department of Health recommendations. So with that, I am going to go to some questions, I guess, while we wait for the Zoom to come back up and hopefully get all our guests back up with us. And so we will start off today with Erie Times News. David, are you with us?
Yes, I am, Kathy. Can you hear me all right?
I can hear you. I'm the only one to answer questions right now, David, so just FYI on that.
Not a problem. Well, let me ask you, you did announce there were 3 additional deaths. I know that's the highest number on any one day for reporting deaths back to, I think, early March 3rd. You addressed this a little bit, but maybe if you can do it a little bit more in depth. How concerning is it that we're still seeing low 20s in hospitalized patients a day due to COVID? We're seeing 3 deaths now for the first time in 2.5 months. Is there worry among the health officials that we're going to backslide more? We've had the steady number of cases. Is there worry now that we may actually see a rise in cases despite 120,000 vaccinated people in the county?
So, the good thing is that most of the most vulnerable in our population have been vaccinated. So our seniors, those who have pre-existing conditions, many of those individuals have been vaccinated, and therefore we're not seeing as great a numbers in the hospital. Hospitalizations are actually down a bit this week, and so are people on ventilators. But what we are seeing is that our numbers really aren't dropping. We're still seeing that consistent level of caseload in our community. And the concern, I think, for those who have been working in this pandemic for over a year now is that too many people who are not vaccinated will decide to take their masks off also, whether they're vaccinated or not. And they are the people who are most at risk. So the person who is vaccinated, even if you get COVID-19, and we've had a little over 50 breakthrough cases, people who have been vaccinated and now they have COVID, or they've had COVID sometime recently, they don't get very sick, and they don't usually end up in the hospital, but they still have COVID. But the person who is not vaccinated, that's the person who could very much end up in the hospital very sick, and unfortunately some of those people will not recover. And it looks like we've got our Zoom back up and running, so I'm going to come back to all of the media in a minute here if we have everyone, I think, back up. I just got the thumbs up, so I'm going to wait and see if I see. But we're going to now turn to Emily Shears, the Director of Operations at UPMC Hammett, to give us an update.
Hi, good afternoon, everyone. Thanks again for inviting us to participate today. At UPMC Hammett, we currently are providing care to 13 individuals with COVID-19, 5 of which are requiring critical care. Across our hospital system, we continue to focus on administration of monoclonal antibodies. This is a highly effective outpatient treatment for COVID-positive patients. To date, we've been able to administer over 2,600 doses to patients, again, outpatient. And this has really proven effective and shown to prevent hospitalization and death by 60%. The current state of COVID may be slowly decreasing, but we want to make sure that all who are eligible and willing receive their vaccine. Vaccine, as mentioned, is one of many ways we can help reduce the risk of COVID within our community. The CDC's updated guidelines on masking, we hope, encourage individuals who are still considering to get a COVID-19 vaccine to get one. UPMC recognizes, as the CDC does, that full vaccination does dramatically lessen the risk of severe illness. At UPMC, our work has been dedicated to expanding access to the vaccine. Approximately 30 UPMC community-based vaccine clinics are focused on reaching our under-resourced areas. We're happy to report that we've now, here in Erie, administered close to 60,000 vaccines for COVID, and we will continue hosting multiple special events with school districts, community organizations, and churches. UPMC is now offering homebound COVID-19 vaccine to residents across the communities we serve in Pennsylvania. This program allows community members who are unable to attend one of the clinics in person to receive the vaccine in the comfort of their own home. UPMC's effort to vaccinate residents in their homes eliminates the barrier of accessibility for some community members to receive the vaccine. COVID-19 vaccine, again, is an important step toward reaching that herd immunity. So UPMC Hammett is ready to vaccinate all community members ages 12 and above. To schedule an appointment, you can either call 844-876-2822 or visit vaccine.upmc.com. And we know that in general, vaccination of more people in the community does decrease the risk of COVID-19 virus transmission. However, in response to recent reduction in masking requirements, please note there are still many places and settings where masking is wise. Those include areas like healthcare settings, settings with vulnerable or immune compromised individuals, and in certain higher risk locations like group transportation. I'd like to close by recognizing our amazing and resilient staff at UPMC Hammett and our physician network. We simply could not have weathered the past year without their dedication to our hospital and to providing compassionate and world-class patient care. Thank you.
Thank you, Emily. And I'm going to go back to John Gennaro, the director of Erie's VA Medical Center, because I don't believe his message actually came through as we had a Zoom crash. John?
Thanks, County Executive DAHLKEMPER. I'd like to recognize the work that your office has done, our partnership with the Erie County Hospital Authority, along with the community hospitals that are present today. Today, the Erie VA has administered nearly 17,000 vaccinations, and now we currently are offering walk-in clinics to all veterans, their spouses, caregivers, and that occurs every Thursday and Tuesday at our main facility from 8 a.m. to 4 p.m. And to save you time, we encourage you to call before coming to the facility. And if you don't receive care here, you're welcome to check out online the Keep Me Informed tool at erie.va.gov and register beforehand. I want to echo the sentiment that you've made along with Emily, that vaccination is the hope we have to get back to doing things that are most important to all of us, and highly encourage our community to continue to get vaccinated here. And likewise, safety continues to be a high priority at the Erie VA, and masking is required for veterans and visitors to all our VA facilities. Thank you.
Thank you, John. And now we'll go to Marcus BABIAK, the Chief Operating Officer at Mill Creek Community Hospital.
Thank you, County Executive DAHLKEMPER. Good afternoon. I'm very happy to share with you that currently Mill Creek Community Hospital has no COVID positive inpatients admitted at this time. Here at the hospital, we continue to require temperature and symptom screenings for all those who wish to enter the hospital, along with the continued wearing of a face mask. Additionally, we continue to limit our visitors to the facility and maintain enhanced COVID-19 protocols to keep both our patients and our staff safe. With regards to the COVID-19 vaccine, the second dose clinic scheduled for tomorrow, May the 20th, 2021, at the Bayfront Convention Center will be our last mass vaccination opportunity that is held at the Convention Center. Due to the decreased demand, mass vaccination clinics scheduled after tomorrow will be held at the LECOM Center for Health and Aging, located at 3910 Shaper Avenue in Erie. We are continuing to accept walk-ins for all of our mass vaccination clinics, or an appointment can be scheduled using one of the three following methods. They can be scheduled online through lecom.eventbrite.com, from the link on our website, lecomisaging.com, or by calling 1-866-LECOM-19. That's 866-532-6619. For those individuals who are homebound and would like the opportunity to be vaccinated at home, please contact 814-844-3155 to schedule a vaccine appointment in your home. Again, that's 814-844-3155 to schedule a homebound direct appointment. Lastly, I have a new vaccination opportunity that I'd like to share with you all today, and that is through Colonial Family Pharmacy, which is located on Colonial Avenue in Mill Creek Township. Colonial Family Pharmacy now has both the Moderna and Johnson & Johnson vaccine in stock, and they're currently administering vaccine by appointment only on Tuesdays between 1 p.m. and 6 p.m. To schedule an appointment with the Colonial Family Pharmacy, please call 814-835-0000. And that's Colonial Family Pharmacy for either the Johnson & Johnson or Moderna vaccines on Tuesday between 1 p.m. and 6 p.m. And they can be reached to schedule an appointment at 814-835-0000. To date, LECOM Health has administered over 40,000 COVID-19 vaccines and will continue providing all 3 vaccines based upon the needs of the local Erie community. As Emily shared, I'd like to thank all of the hospital staff and especially the nurses. We're coming off the heels of both Nurses Week and Hospital Week. So I'd like to express my gratitude and the thankfulness of all the hospital administration to all those who work at Mill Creek Community Hospital for the dedication they've shared during the COVID-19 pandemic.
Thank you so much, Marcus. And now finally, we're going to have Dr. Dan Musio, who is the Chief Medical Officer at Allegheny Health Network St. Vincent's Hospital. Dr. Musio.
Good afternoon, everyone. I am grateful for the opportunity to provide a report on our status at AHN St. Vincent. Our number of COVID patients has recently stabilized in the 6 to 12 range. Today, we have 8 patients suffering from COVID infection in the hospital. As a reminder, our peak COVID patient census was in December, when a quarter of our hospital was occupied by patients with COVID-19 infection. Both December and January were difficult months for our patients and staff. Following that, the numbers trended downward, but clearly the disease is still with us. This has necessitated that our 7th floor remain a COVID unit. We continue to see a decrease in the age of patients requiring hospitalization. The vast majority of the patients we see with COVID have not been vaccinated. We continue our campaign to vaccinate as many people as possible. To date, we've administered nearly 55,000 doses of vaccine. 26,500 of our patients are now fully vaccinated. And thus far, we've vaccinated 450 kids in the 12 to 15 age range. We are beginning to transition from mass events to more targeted outreach. We have administered vaccine at churches, schools, community centers, and today we are at the Erie City Mission. We plan to begin offering inpatients in our hospital vaccination with the J&J vaccine prior to discharge. Our focus at this point is to address the hesitancy that exists in receiving the vaccine. We know that it is safe and effective. That is our personal experience after administering close to 55,000 doses. Patients may schedule via our website, ahn.org, via AHN MyChart, or by calling 814-CONNECT. From a treatment standpoint, we continue to offer monoclonal antibody fusions to symptomatic COVID-positive outpatients. Thank you very much for the opportunity to speak this afternoon.
Thank you, Dr. Musio, and thank you to all of our health partners. Obviously, we could never have gotten through this past year without each and every one of you and your amazing staff. So thank you to every one of our healthcare workers at each one of your great facilities. And with that, we're going to go back to the media, and Joel with Talk Erie.
Thank you, County Executive. Appreciate it. I do have a question for the healthcare providers, and anyone could take this. With the lack of demand now for the vaccine in the current phase, is it incumbent upon your primary care physicians in your network to encourage their unvaccinated patients to get inoculated?
Anyone like to take that?
I'm happy to start. Sure. That's always been part of the strategy, is to engage the primary care physicians to educate anyone with hesitancy or to be able to facilitate those that are requesting the vaccine. So that's still part of our strategy. We're obviously looking down the road. Eventually, we hope to have vaccinations within offices. Right now, with the requirements and the federal regulations, that makes it a little difficult with the tracking, but that's definitely where we'd like to be in the future.
Thanks.
Is that good, Joel?
Yeah, thank you very much.
Okay, sure. Erie News Now.
Hi, a question we'll throw to Dr. Musio. The county executive talked about her concern over the fact that case totals remain fairly steady. Does that concern you as well? And do you think we might see even a small rise in cases as more and more people go without masks, truthfully, regardless of whether or not they're vaccinated?
Yeah, so I mean, both of those are our concerns. I mean, what we've seen is a leveling out of cases. You know, we dropped way down from our peak, but we've been stuck at from a half dozen to a dozen cases a day for about a month now. And it doesn't seem like it's improving at all from there. And yeah, naturally, our concern would be that as people start to take fewer precautions and stop masking, and particularly when you're unvaccinated, we're going to see a bump in the numbers. So yes, we're concerned about both of those things, and we're watching them carefully.
Thanks.
Thank you. We'll go to Jet TV.
Hi, Kathy. Scott Bremner. I just wanted to ask you what your thoughts were about Election Day yesterday in terms of how people responded. Did you hear much from polling sites? Were people basically following protocols, or were some people coming in and saying, look, it's my right to vote whether I'm masked or not?
You know, Scott, I haven't had any chance to talk to the election office about this, as maybe most people don't understand, but the election office is under county council. And I just know that they're still very, very busy down there counting votes. So I haven't touched base with them to find out if there was any issues regarding that. So I don't really have anything to report regarding the COVID mitigation efforts at the polling places.
Just a quick follow-up, do you have any concerns that these were people that may not normally hang out together, that may be getting into a smaller place while they're filling out their ballots, that there might be a little bit of bump in numbers based on the fact that the polling did take place yesterday, or still too early to tell?
Well, I think it's too early to tell, but any time that you put people together, you don't know who's vaccinated and who is, and did they keep their mask on? Did they keep it on properly? Because we know there's a lot of people still wearing their masks underneath their nose, which in some ways is almost like not wearing a mask at all, because you breathe out of your nose also. So I can just tell you that there were a couple cases in November of some contraction of the COVID-19, probably associated with Election Day. But I think for many people who didn't feel comfortable enough, they used the mail-in ballots as they did in November, and hopefully in all the polling places, people did the best they could to mitigate any spread of the disease during the election process. Thanks.
Thanks.
We'll go back now to David at the Erie Times News.
Thank you, Kathy. This one is for each of the hospital folks, if they could each answer briefly on this. With vaccines being out now for several months, what have they seen? I know Dr. Muccio mentioned this briefly, but have you seen many, if any, hospitalized patients who were fully vaccinated when they first contracted COVID? And have you had any deaths of those patients who were fully vaccinated when they got sick with COVID?
Here at St. Vincent, we've seen 6 fully vaccinated patients admitted with COVID. Since the end of January, which is pretty much when we really started to see numbers of people fully vaccinated, we've had 205 admissions. So that's about a 3% admission rate for fully vaccinated people. None of the fully vaccinated patients have died.
At UPMC Hammett, we have also had 4 patients that are fully vaccinated admitted. We have had no deaths.
And for Mill Creek Community Hospital, we have not had any patients admitted who have been fully vaccinated.
And John at the VA?
And locally at the VA, we haven't had any of the COVID admissions here locally.
And if I can just do a quick follow-up, and this is whoever would like to answer, what would you tell people then? You've had some breakthroughs where they've required hospitalization, not many, none of them have died. What does that tell you about the vaccine's ability to prevent people from getting critically ill?
Well, I can state that we, even through studying the 90,000 UPMC employees, have found the vaccine to be right around 95% effective at preventing illness, which is very, very good and very high. So this is not unlike influenza when you do have some breakthrough with vaccinated individuals there, different strains circulating, et cetera. So this was not unexpected. We're still seeing far less than 1% of those individuals vaccinated having breakthrough disease overall, and even lower numbers of those individuals requiring hospitalization.
Yeah, I would echo that. I mean, you're much less likely to contract the disease. And if you do, it appears you're not going to be as ill, and your risk of death looks like it's going to be far lower. So, I mean, that's a win-win-win for the vaccine all the way.
Thank you very much.
Thank you. That's a great question, and I think it just goes to show that this vaccine is very, very effective. And it never said it was 100%, but gosh, it's doing a phenomenal job in helping to keep people healthier and out of the hospital. So thank you to the scientists who got us to this point. We'll go back to Joel at Talk Erie.
Thank you, County Executive. Maybe a question for both the AHN network and the UPMC network. You know, the state is reporting today that only 9% of all ICU beds in Erie County are available, and that's around 11 beds according to the state. And actually, the average 14-day ICU bed tracker is approaching the lows we had in December. So could you explain to our listeners what about ICU bed availability? Is this a problem or more of an indicator of back to normal hospital operations?
I mean, for us, it's back to normal hospital operations. We had converted our 7th floor into a hybrid unit where we have ICU step down and floor beds all on the same unit. And before COVID, none of those beds were ICU beds. So we have the same number of ICU beds now as we did prior to COVID. And so we're, you know, to the extent that our ICU beds are full, that's with patients without COVID and people undergoing heart surgery or cardiac procedures or suffering from other illnesses.
And just to echo those comments, pre-COVID, capacity at most hospitals is usually very high. With our new patient care tower, we've actually added more critical care beds, and those have been filled with non-COVID critical care patients, again, regional transfers from other UPMC hospitals as well. All of those conditions tend to seek critical care. So this is really getting back to pre-COVID capacity levels.
So just a quick follow-up. When we were hearing in the middle of the high mark, as far as the number of patients in acute care, that anything below 20% was a crisis, that really wasn't the case? Or I don't want to put words in your mouth. Could you clarify that?
I guess I don't know specifically what comment you're referencing from the past, but during our surge, we did surge and have more critical care space available, rooms that could take a ventilator, and did take a ventilator if they were required. Now we are back to our, I would say, regular complement of critical care beds, and those usually run at pretty high capacity as pre-COVID they did.
Yeah, I guess in our situation, it would be what you're looking at is staffed ICU beds. So our number of available non-COVID ICU beds never decreased, but we moved much of our ICU staff to other units to care for ICU level COVID patients. So at the height of the pandemic, we had 4 units open, and many of those patients were ICU level care. So none of them were actually in our ICU because of the negative air requirement for infection control, but our nurses were in those units. So when we were running into issues, it was really with staffed ICU beds. So now we're in a far different place because very few of the COVID patients are ICU patients. So all of those ICU nurses are back in our regular units. So I know when we run into difficulties, it's generally not physical. It's not a physical problem. It's not that we don't have beds. It's staffed beds that that tend to be the rate limiting step.
Thank you for the explanation. I appreciate it.
Thank you. Very interesting question and answers too. I appreciate that. Erie News Now, Ethan, you have a question?
Hi, a question for, we'll go to Dr. Musio again here. As we look to more or less fully reopen the state in about 12 days, from a medical perspective, do you have any concern about that? Do you think we're in a position to be able to do that, or would we be smarter to wait on that with cases and hospitalizations still kind of remaining level?
I mean, I think, I think what's been decided pretty much is it's clearly people's personal choice. I mean, the advice from the CDC is if you're fully vaccinated in many different situations, you now no longer need to wear a mask unless you have a health condition that would put you at risk. I mean, I think the prudent thing for people to do would be to go at this slowly. I know in our hospital, we haven't changed a single rule. We're all still masking, we're wearing shields, we're taking all the precautions. And I think that makes sense. We're essential workers. The state chose to vaccinate essential workers first. I think it makes sense to take the masks off your essential workers last. I think it's important to protect ourselves, while the rest of the population, embarks on this experiment where we take our masks off and we see what happens. I don't think anybody really knows what's going to happen. I think the CDC is basing their guidance on the best science available, but I'd be kidding you if I told you I knew exactly what was going to happen once we all stopped wearing our masks.
Thanks.
Thank you. And we'll go back to Scott at Jet TV.
Kathy, this is for you, and this is just a personal assessment of trying to reach that number down to that 25, 30, whatever percent. Obviously, things are slowing down. We're slowing down as we're trying to approach the finish line. What are your hopes or your concerns about whether or not we're ever going to get there where we can consider it a herd immunity, or if we're going to have to just accept the fact that at 35 or 40%, that's about all we could do given some of the concerns people still have about getting the shot?
So I believe that we will get to a better place than we are today. We have a little over 50%, about 53% of eligible individuals who've gotten at least one vaccine shot so far. And it has certainly slowed down much from where it was even a month ago in terms of the number of people getting vaccines on a daily basis. But we're still seeing people going out and getting vaccine. And, parents have decided, yes, they've talked to their children, and yes, my child who's 12 and up can get a vaccine, and that will help our numbers also. So, I mean, my hope is that more and more people will see the value of this. Unfortunately, some people will see the value because someone they know who's not vaccinated will get very ill, and potentially be in the hospital and potentially even pass away. And I've seen that happen over the number of months, people who told me they didn't believe that this was anything more than the flu, or once we had vaccines, some people who said they didn't believe in the vaccine had that happen to them in their family with their loved ones and now have decided to go get the vaccine. So unfortunately, some people will not move forward on the vaccination until that point, but I hope that more and more people will see, as we're all saying, a very safe vaccine, a very effective vaccine, and they'll want to get out and do more things with people and feel safer, feel more protected, and the vaccine will be their choice then.
Thanks.
Sure. And I did want to mention Melissa Lyon is with us today, so if any of the media wants to ask her a question, I hadn't said that before, and I should have, but we'll go back for one last question from each media outlet, and we'll start again with you, David, from Erie Times News.
Thanks again, Kathy. My question is about side effects from the vaccine. Have any of the hospital leaders seen patients require hospitalization due to side effects from the vaccine?
At St. Vincent, we've had one patient admitted with a vaccine side effect. It was an allergic reaction. They were briefly hospitalized, treated, and went home.
We have had one young individual have some cardiac episodes following vaccination, was a very brief hospital stay, treated, and discharged with no symptoms.
And at Mill Creek Community Hospital, we have seen a handful of individuals who required treatment or at least a brief observation in the emergency department post-vaccination, but none who have required admission for any severe allergic reactions.
And likewise at the VA, we haven't had any admissions for severe reactions, and any other interactions we've reported accordingly.
And Emily, you kind of broke up on me toward the end of yours. Can you repeat what you said about Hammett?
Sure. We had one younger individual that had some cardiac episodes following vaccination, so it's hard to say if it was related. They were admitted for observation and then discharged with no concerns.
Okay. Thank you.
Thank you. We'll go back to Joel at Talk Erie for your final question.
Yes, this one's for you, Kathy. I'd like to get your response to the voters' endorsement of the 2 ballot questions limiting the governor's ability to extend disaster declarations without legislative input.
I'm very concerned about those ballot initiatives because I do believe the governor needs to have the authority. You know, this could be a tornado, it could be a flood, it could be a pandemic, and you need quick action, and we know the legislative body works much more slowly, and so I do believe it's necessary. And there was never an issue before the pandemic. Unfortunately, the pandemic became political, and hence we're at where we're at. But I do think it's going to be, it could potentially be problematic in the future.
Thank you.
Sure. And we'll go to Erie News Now to Ethan.
Question for Director Lyon. As we look at new guidance on masking, what's your advice from a public health perspective for business owners throughout the county in terms of masking policies? Would it be wise to ask people to show proof of vaccination or wise to require masks regardless? What's the public health advice on that?
Thanks, Ethan. I had understood that the county executive didn't mention that I was on the press briefing, which was really fine with me, actually. I enjoyed watching all of my healthcare providers take a lot of the calls, questions today. But from a perspective from public health, I feel the businesses have been put in a place that's been very difficult. The message has been very messy, and so I empathize with them as they're navigating this. That's my first message to them. I thank them for everything they've done thus far and understand that this is still challenging. All businesses, workplaces have the ability to have more restrictive or additional parameters for masking that would be what we would call universal masking. So everyone wearing a mask regardless of your vaccination status. They have the prerogative to do that to protect their patrons, their clients, and also their workforce. I understand that they may not want to. If they were to do that, from a public health perspective, we support approach, because we know that it really does prevent the spread of disease, and we need that now for a while longer. However, them asking for proof of vaccination will become very difficult. I think it may become confrontational, and I don't anticipate that many workplaces or businesses are going to go down that avenue. So with that being said, I think the message has been it's an honor system, and I think the other piece that I'd like everyone to know too is just because someone is wearing a mask, I don't want people to jump to the conclusion that they're not vaccinated. So for myself personally, I'm still wearing a mask when I go into public settings because we do know that there are breakthroughs. We also know that it's better to prevent spread of disease, and I'm modeling that as well for the community. So with that being said, just be kind to one another as we navigate this together, but doing the right thing is very important. So that's what I'd like to say for the moment. Thanks, Ethan, for asking.
Thanks.
Thank you. And now we'll go to Scott with Jet TV for your final question.
Yeah, you know what, County Executive? I think I'm good, so I will pass. Thank you very much.
All right, that's perfect. Well, thank you. And thank you again to all of our health partners who have been with us every step of the way through this pandemic. It's not over. I know many people want to think the pandemic is over, but it is far from over, as you've heard today. And the Erie County Department of Health and our health partners and other partners throughout this community will continue to do their work to keep this community as safe as possible going forward. As a reminder, the current mitigation guidelines are still in place until May 31st, and even then, face masks again will be required for those who are not vaccinated. And as Director Lyon said, many businesses will still require you to wear a mask when you go in there, and I ask you to respect their decision. At the county courthouse, county buildings, we are also going to still be requiring masking for those coming into our facilities. So please respect all businesses who make that decision going forward. And I ask all of you to continue to wear your mask even when you're out amongst people that you don't know and you're not sure who's vaccinated. It is the prudent thing to do, and it is the best way to keep yourself and this community safe. Always keep your hands washed. Don't stop your personal hygiene. If you feel sick at all, please stay home. That is so important also until you get a test, find out whether you have COVID or not, and then decide if you can go back to work or school or whatever. And I ask people to, again, consider getting vaccinated. If you're not, help to stop the spread of this virus throughout our community. And one last thing, well, first of all, on the vaccine, go to vaccine.gov if you're trying to find a place in Erie County where to get a vaccine. You heard from some of our providers where you can access their vaccines, but you can go to vaccine.gov, great website, all sorts of sites on there in Erie County and the surrounding counties. And lastly, I want to tell you that next Wednesday will be my last regularly scheduled Wednesday press briefing. I have been doing these press briefings since mid-March last year. We finally got into a once-a-week press briefing, but as summer comes and a lot of the mitigation efforts are lifted, we will have press briefings as needed, but not on a regular weekly basis. So next Wednesday, the 27th, will be the last regularly scheduled Wednesday press briefing, and I want to thank everybody who's been involved in helping us get this message out. And a particular shout out goes to our media, who have been phenomenal partners throughout this pandemic and will continue to be, I know, going forward to continue to get the message out to our community, helping to keep everyone safe. In the meantime, have a very safe week, and we'll see you next week. Bye.